The Global Coronavirus Vaccine Initiative, COVAX, aims to deliver 2 billion doses to people in 92 lower-income countries by the end of 2021.
It is a strategy to rapidly contain the pandemic, save lives, protect healthcare systems, and restore the global economies based on human rights principles of equity and epidemiologic evidence from the pandemic.
The U.S. joined COVAX on January 21st, the same day it rejoined the World Health Organization. President Joe Biden reiterated the message Thursday.
We've also re-engaged with the World Health Organization. That way we can build better global preparedness to counter COVID-19, as well as detect and prevent future pandemics, because there will be more.
That's a departure from his predecessor, who withdrew from WHO in July 2020.
Because they have failed to make the requested and greatly needed reforms.
But Biden's administration has provided little detail on the scope and scale of U.S. commitment beyond the $4 billion funding approved by Congress in December for Gavi, the Vaccine Alliance, one of the co-leaders of COVAX.
We have reiterated our commitment to COVAX. I don't have any additional funding, though, to announce today.
To meet its target, COVAX says it needs $4.9 billion in addition to the $2.1 billion it has already raised. It's also dealing with vaccine scarcity as wealthy countries build up stockpiles for their own populations. 40 million doses of the Pfizer-BioNTech vaccine have been promised to COVAX, but only 1.2 million are available in the first quarter of 2021.
We encourage every manufacturer to make the largest number of doses they can available early so that we can make sure that we get equitable distribution going.
In addition to the Pfizer-BioNTech shots, COVAX will distribute 336 million doses of the AstraZeneca vaccine in the first half of this year.
There was vaccines that they were clearly available, that they had some control over, and started to make those allocation projections primarily so countries could begin to plan. They're not finished, and so we're going to see much more from COVAX about more vaccines going to those countries with the opportunity to reach initially 3% of the population, but with a larger goal of 20%.
The hope is that with this initial forecast from COVAX, countries can begin their immunization strategies, including storage, distribution, and how to address vaccine hesitancy. Patsy Widakuswara, VOA News at the White House.